Recording. Thank you all for joining us for the June 17th Sacramento County Media Briefing, our last media briefing. If you were here last week or read the news release, this will be our last weekly media briefing. We will continue to accept media requests through our covidmedia@saccounty.net email address. But with us moving beyond the blueprint, we will cease having these weekly meetings. So I will go ahead and turn it over to Dr. Casterier for an update.
Good morning, and thank you again for joining us. So brief update on the numbers, and these are numbers from yesterday. 107,494 cases of COVID-19 reported to Sacramento County and 1,726 deaths. We are averaging between 50 and 60 cases being reported on a daily basis. And our case rate is 3.7 per 100,000. Test positivity is at 1.9%. We have now had given over 1.3 million doses of COVID-19 vaccine, and our vaccination rate for residents of Sacramento that have received at least one dose is 60.8%. And then for those that are fully vaccinated, 51.3%. For the health equity quartile, for those that have received at least one dose, it's about 50%. So the main changes for Beyond the Blueprint, the two main changes are that there are no longer any capacity limits and no social distancing required either. For those that are vaccinated, they do not need to wear face coverings except in certain settings, that is public transit, in jails or correctional facilities, in healthcare settings, in schools, and in homeless or cooling shelters. For mega sites, there are additional requirements for being able to have a system for verifying vaccination, and mega sites are classified as those with 5,000 plus attendees for indoors and 10,000 plus for outdoors. We are still waiting for a final ruling from Cal OSHA that will provide guidance for businesses and especially for employees. So once that is available, we will be providing that information out to the public. So with that, I will turn it over to Jamie.
Great, thank you, Dr. Kay. I'm going to give an update on some of the variants. So the World Health Organization announced a new common use naming convention for COVID-19 variants on May 31st. The new system is based on the letters of the Greek alphabet instead of using the geography of origin, which can be stigmatizing to some countries. For this reason, the WHO wants the media and non-scientific communities to adopt the new Greek letter system. The established alphanumeric nomenclature systems for naming and tracking SARS-CoV-2 genetic lineages by scientists are unchanged. Sacramento County Public Health epidemiology will continue to list the scientific Pango lineage and both the old geography of origin and new Greek letter names on our COVID-19 laboratory dashboard. However, we plan to sunset the use of the geography of origin names on the dash after a temporary period of overlap. As a reminder, the CDC classifies SARS-CoV-2 variants as variants of interest, variants of concern, and variants of high consequence. It's notable that the CDC variant classifications do not align exactly with the WHO classifications. We are following the CDC classifications. To date, the state has notified us of 815 specimens that were confirmed as variant strains. Locally, variant cases are more common among younger age groups than non-variant cases. A variant of concern is one for which there is evidence of an increased transmission, more severe disease, less immunity, whether that's natural or through vaccination, a diagnostic failure and or treatment effectiveness. Variants of concern that are circulating locally include the following strains. Alpha, formerly the UK variants, they have about a 50% increased transmission and potential increase in disease severity. Beta, formerly South Africa, with about a 50% increased transmission, reduced treatment susceptibility, and reduced immunity. Epsilon, or West Coast / California variant, 20% increase in transmissibility and reduced immunity. Delta, which is one of 2 India variants. This has just been newly classified as a VOC due to increased transmissibility. They don't have an exact proportion currently, and possible reduced treatment susceptibility. And then finally, Gamma, which is Japan / Brazil variant, because of reduced treatment susceptibility and reduced immunity. The former New York variant and the other India variant Kappa strains are circulating locally, remain just variants of interest. Fortunately, we have not been notified of any variants of high consequence circulating locally. A variant of high consequence has clear evidence that preventive measures or medical countermeasures have significantly reduced effectiveness relative to previously circulating variants. And that's all I have.
Okay, thank you guys. So that concludes our briefing. If there are any questions, we can go ahead and take them now. You can either raise your hand on the Zoom, or you can put a note in the chat, and we can go ahead and take questions if there are any at this time. Okay, okay, Chris Hagan from Cap Radio.
Yeah, I was wondering if you could speak a little bit more to the status of the Delta variant locally. Do we have an idea of like what percentage of cases locally are the Delta variant, or how concerned your department is with the Delta variant right now?
So we've had 15 cases of the Delta variant to date. You'll note currently they're combined on the dashboard with the Kappa variant. The team will be splitting those out tomorrow when they do the update, so you can have more of an idea. I mean, as the name indicates, they're a variant of concern. So obviously we're concerned about them. It's something that we're watching closely. I would say in terms of volume, though, we're seeing more of the Epsilon and the Alpha variants. We're seeing a larger volume of those 2, which are also variants of concern.
Thank you.
Do we have any additional questions before we wrap up? Okay, as a reminder, I will send out this recording in its entirety after the meeting. And as I mentioned at the beginning, this is our very last scheduled weekly media briefing. Thank you guys so much for joining us for these on a weekly basis. We've enjoyed having direct contact. You can still reach out to our COVID media at saccounty.net for media questions, requests for interview, and we hope that you'll continue to remain engaged in our effort to get our community vaccinated. So we will see you later. Bye.